Inflammatory bowel disease is a condition, chronic condition, which is mediated by our immune system. It's called, in medical terms, autoimmune disease, where it affects the gut due to a complex process. It can cause a variety of symptoms like blood in the stools, loose stools, weight loss, abdominal discomfort. So there are two main types of inflammatory bowel disease. One is called ulcerative colitis, and the other one is called Crohn's disease, which is slightly less common. So ulcerative colitis causes diarrhea, urgency, need to go to the toilet quite often. And sometimes patients might notice blood mixed with the stools and a bit of mucus, which are the main sort of symptoms. And if it's not treated, it can progress to having more and more frequent bowel movements, affecting the life and work situations eventually. So Crohn's disease is a little bit more subtle in presentation. It can go on and on for quite some time with abdominal discomfort. And it can cause weight loss because of reduced absorption of nutrients, and the small bowel can get inflamed. So these conditions are common in the Western population, and it's due to the immune system going in an overdrive type of a setting. So treatment for inflammatory bowel disease is not just medication. It involves quite a few domains, including nutrition. So when we see patients with inflammatory bowel disease, each patient requires a different customized treatment plan. So we explore the symptoms and what sort of effect it's having on their body, and also on their blood tests. So for example, if a patient has got ulcerative colitis, and if it's just limited to the lower part of their bowel, we give something called a topical treatment called mesalazine. And we also make sure that they're not having any nutritional deficiencies or low blood counts such as anemia. So it's all by patient-to-patient basis, by a customized approach. So unfortunately, there's not much strong evidence to promote a particular type of diet for patients with inflammatory bowel disease. Patients, when they present to clinic, they might already have found out certain food groups which upset them, their body system. So they would be avoiding them already. There's been lots of research done on this, and unfortunately, there's no one set recommendation. However, if patients have narrowing of the bowel due to a form of Crohn's disease where the bowel is very narrowed, then we usually recommend to avoid any fiber-rich foods. So we recommend what's called a low residue type diet in those situations. And it's monitored very frequently by the specialist, and also we involve dietitians in the setting. So if there are situations where the bowel inflammation can get very severe, for example, requiring an urgent treatment to calm it down quickly. So in those situations, we use medications called steroids, which calms down the inflammation quite quickly. Apart from that, if it is moderate or severe inflammation, we also consider immune suppressing medications, and also a group of medications called biological medications, which are highly technically advanced forms of treatment. The surgical options in inflammatory bowel disease is quite differs from ulcerative colitis and for Crohn's disease. And obviously, if the medications are not working, then we would recommend having an operation to remove the affected inflammatory area. But the technicalities of the operation differs in ulcerative colitis and Crohn's disease, but I don't want to go into too much of a detail. But usually there'll be about 2 scenarios where it would necessitate it. The main one is where the medical treatment is not helping and patients are not having their inflammation controlled. And the other indication is if patients have had an acute flare-up of the inflammation, which is not calming down or responding to acute treatment like steroids on an inpatient basis, then some small number of patients might require an operation to be done as an urgent basis. So these two are the main indications. And also there is a small risk of bowel cancer in the long term for patients with bowel inflammation. We are looking at after having the condition after decades, small proportion of patients might develop bowel cancer. So in that indication, patients might require an operation. But all the indications are, I try to discuss with the patients on an individual basis and explain the rationale behind it.